Good morning, everyone, and thank you for joining us here this morning on this very important announcement as we announce Vaccination Week of the Americas. This year is the 21st anniversary of the Vaccination Week in the Americas, or VWA, which is being held April 22nd to April 29th. And every year, as part of Vaccination Week of the Americas, more than 40 countries and territories in the Americas come together to recognize the significance of immunizing and vaccinating their populations. An exceptional effort is made to reach individuals who may not have consistent access to health services and people living in urban areas. The Vaccination Week of the Americas 2023 theme is Get Up to Date, #Each Vaccine Counts. Vaccination Week of the Americas has been a critical force in immunizations in the Americas, resulting in more than 806 million people being vaccinated against various diseases since 2002. Bermuda will be celebrating in 4 ways. 1, we are continuing with the advancement in reducing the number of vaccine-preventable diseases that have caused death and disabilities to children worldwide, such as measles, rubella, polio, whooping cough, and tetanus. 2, we are encouraging parents to vaccinate their infants and children according to the Bermuda Childhood Immunization Schedule. 3, we will create a significant recognition of Vaccine Week in the Americas and immunization to promote vaccination as a productive means of fighting childhood diseases. And 4, we look to expand on policies that will increase trust in vaccination through strategies targeting community stakeholders. In addition, on Friday, the 28th of April, the Department of Health will hold its dance walk with Burmy Jermy throughout the city of Hamilton, and that will start at 12:15. If you are out and about, take a picture with Burmy Jermy, upload it to your social media, and tag the Department of Health Bermuda for a chance to win a prize. Right after the dance walk at approximately 1 o'clock, the Department of Health will gather on the steps of City Hall to launch a new and exciting app that will provide health information at your fingertips. The Department of Health invites the public to join us in launching Healthy People BDA. You can download the app, learn the onboarding process, and learn how to navigate it. And the first 50 people downloading the app will be entered into a draw for a prize. As we gradually move forward from the COVID-19 pandemic, and with the help of the COVID-19 vaccines, Bermuda has gained good coronavirus protection within our community. Around the region, though, there have been instances of measles outbreaks, and Bermuda is no exception, as we are at risk simply because we have more travelers coming to our island. To strengthen the uptake and increase confidence in various vaccines in Bermuda, the expanded program on immunizations under the Department of Health will provide a catch-up clinic at the Victoria Street Clinic beginning on Saturday, April 29th. During our week celebrations for Vaccination Week in the Americas, we will promote the catch-up clinic as well as educate the public on the reasons for having the measles, mumps, and rubella, or the MMR vaccine, as it is essential for clients and for building up immunity within our community. We will also provide education on the importance of boys and girls being vaccinated for human papilloma virus, or HPV. Immunizations have been one of the most successful public health interventions to save lives locally and globally, and the benefits have expanded to adults, and the Department of Health encourages families to participate in vaccinations to protect Bermuda and the world. And I'm joined with the stellar team of the Ministry of Health who can answer any questions that you have about vaccination or vaccination awareness. Thank you, Tarai.
Thank you very much, Minister, for your presentation and your remarks. At this time, we're going to invite members of the media to ask questions related to this subject, starting with Gary Foster-Skelton from Bermuda Broadcasting.
Thank you, Minister, and the Ministry of Health team. So, looking back over the pandemic, there had been reports looking at News Medical on US stats that between 2019 and 2021, the percentage of infants who receive full 3 doses of vaccine against diphtheria, tetanus, fell by 5%. HPV vaccination coverage fell after during the pandemic. So, where are we? Can we get any picture of how we've been impacted by the pandemic in people getting vaccinated, infant vaccinations, do you have any percentages of where we're up, we're down, compared to pre-pandemic here in Bermuda?
Sure. Using the 2021 data, Gary, the MMR number one is at a 88% success rate. So that's for first doses of persons that are at 15 months. The MMR number two is at 65%, and that's the second dose for children between the ages of 4 and 6. Polio is at 88%, and that is the start for the fourth dose, and fully immunized is 4 doses, one each at ages 2, 4, 6, and 18 months. And that's for our 2021 data. And the coverage rates are below the 95% coverage as recommended by the World Health Organization to help to prevent outbreaks of measles and or polios. However, as you'll note, that this particular initiative this week is specifically designed to improve our vaccination rates, encourage families to ensure that they have their children immunized in accordance with the Bermuda standards and the like. So that's certainly why we're having this particular vaccination week of the Americas, to help highlight the importance of immunization.
Indeed. And so that's the 2021
Correct.
statistics.
Correct.
88% of children getting the first MMR, then quite a drop to 65% getting their second. So how does that compare with pre-pandemic percentages, if anyone can tell us that? And what has happened essentially in people's minds? Has the pandemic increased? Obviously, there's a lot of talk about vaccination. So has it increased awareness, increased take-up, or is there more resistance?
Thank you for that. And that's a really important question. And we've had some of our resistance around that we know occurs, and just even for access to people's perception during the pandemic, and so not coming to get vaccinated during that period. And so that's why we're really trying to rebuild back better and improve the immunization coverage. So pre-pandemic, you were aware of our vaccine strategy that we had 2018 to 2021, and that was the beginning of that. And we saw some positive results just at that time, and they had increased. So they've gone back down again during this period, and we're looking to spend this week rebuilding.
And if there was one goal you wanted this week, something to happen this week or happen after this week that hasn't been happening, what would that be?
Certainly for everyone to come, those who haven't had their MMR to be vaccinated and do the catch up, because as the minister mentioned, we're just a journey away. Measles is occurring in other areas, and it's really important for us to maintain the gains that we have achieved over the years, and that has been with high coverage. Our goal is to have coverage for all of our vaccines at almost 95%. That helps us to have what we call community immunity, so that we're all protected from these diseases. And as you know, we travel quite a lot as well.
What will you be doing this week to address things like vaccine skepticism? People who have become less comfortable with vaccines during the pandemic.
You know, we're encouraging all of our health providers and the community to have a discussion with their physicians. A part of what we're also doing this week is a workshop with all those physicians and offices and nurses involved in giving vaccines. And we hope to actually address part of that conversation so we can improve the communication around vaccines and around hesitancy. So we're encouraging people to be aware. This is Vaccine Awareness Week, and for people to have those discussions with a trusted health provider. And it's important conversations to have. We will be doing some work on regenerating the vaccine hesitancy strategy. And as you may remember, we actually had listening sessions with community on the vaccine hesitancy when we did the vaccine strategy 2018 and 2021, that 3-year period. So we hope to do something very similar to hear the concerns of people. But I want to reiterate, really, vaccines are safe and effective, and we really do encourage everyone to come and discuss their vaccination and discuss their concerns.
And my final question will be, we did see during the pandemic, there was a demographic difference, racial demographic difference in those who, in where the majority of the vaccine hesitancy was. How is your approach to that?
Well, and we now have our health visitors that are actually back out in the community doing home visits as well, which they were making contact with families before. So we're back out in the community and resuming much of our preventive health programs that include our health visitors reaching out to families as well.
Okay, thank you very much.
Thank you.
Thank you, Gary. At this time, we invite Sean Connolly from the Royal Gazette.
Oh, hello, Minister
Good
and
morning.
members of the team. It's nice to see you. Sean Connery from the Royal Gazette. Just following on from what Gary was asking, there's always been a bit of a resistance against things like MMR, like in certain sectors of the population. I remember when Tony Blair became a dad, when he was Prime Minister, there was huge controversy in Britain because he wouldn't state whether his new son had MMR or not. So that's always been there, and then it just exploded during COVID with the never vaxxers and the conspiracy theorists, fed by the internet and social media, etc. So as Minister of Health, I mean, what specifically can you do to try and push back that flood of disinformation that happened over the past 3 years?
Thank you for that, Sean. And I think one of the things that we can do is by encouraging this constant engagement and having press conferences such as these, so that we've got, both the BBC and the Royal Gazette present, so that they can hear the delivery of what we're speaking about, which is important to reiterate the fact that vaccines do work. And the reality is that from a community perspective, in order for us to best achieve herd immunity and full protection, we need to get to that WHO 95%. There has been a decline, which we've just acknowledged with respect to the data, and hopefully by conversations such as this, public awareness that you can help with the distribution and the dissemination of through the press, the Friday event that we're speaking about. And then, as Lynn said, it's really important and critical for persons that have questions to go to trusted sources such as their physicians, so that they can discuss any concerns that they may have with their physicians and be advised accordingly.
But you would agree, though, that it is much harder now after all the disinformation during the pandemic, such as, you could inject yourself with bleach and, not contract it. So it's now a much tougher sell, isn't it?
It is somewhat of a more difficult sell because of the, regrettably, some of the false information that's been circulating on the radios and the byways and through the internet. However, again, I'd like to reinforce the fact that we've got two press media outlets here in Bermuda that can assist us in delivering the message. The Royal Gazette was tremendous when we were going through COVID insofar as trying to promote vaccine awareness, as was the BBC. And through this type of engagement and continued community education and the week of activities that we have planned for the week, I think that we're on a good wicket. There is, notwithstanding some vaccine hesitancy, which we recognize, largely driven by incorrect information through the social media outlets. But again, all we can do is try to counter that by providing the proper evidence-based information.
Great. As Health Minister, you've passed the probe into Belco pollution to DE.
I'm sorry, pardon me?
As Health Minister, you've passed the probe into Belco pollution emissions to the DENR. What do you say to people who also claim that in doing that you've passed the buck as well?
As I articulated previously with respect to that, and hopefully it'll be recorded, under the Public Health Act 1949, there is a provision that speaks specifically to public nuisance. However, also under the Public Health Act 1949, if an abatement order is issued by the Minister of Health concerning certain circumstances, and the abatement is not mitigated, then the only remedy under the Public Health Act 1949 is to go to the magistrate's court, who can impose a penalty in the sum of $2,500. Contra to the Clean Air Act, which is a more newer piece of legislation, which is in fact was enacted to help to address some of the shortcomings in the Public Health Act of 1949, because the Clean Air Act, I think, is 91, and that was to deal with emissions and the like. Under the Clean Air Act, the minister responsible has the power to issue it's an order under the Act. I can't think of the name of it right now, but there's an order under the Act.
Do you mean statutory nuisance?
No. Statutory nuisance comes under the Public Health Act 1949. I'm emphasizing that because subsequent to the Public Health Act, there was the Clean Air Act that was designed specifically to address situations such as emissions and so forth. Under the Clean Air Act, and I think it's 91, there is an ability for the minister responsible for the environment to issue it's gone from me, but it's a particular order against a particular institution that is creating emissions or soot and the like. Under that piece of legislation, in the absence of those issues being addressed, that minister has the power to issue a fine in the sum of $50,000 per day. So you can appreciate under the Public Health Act, the penalty is far less. It's $2,500 period, versus under the Clean Air Act of 1991, which again was designed specifically to address some of the issues of soot and fallout and the like. That is a more recent piece of legislation, recognizing that the Public Health Act that deals with a statutory nuisance has a minor offense, a minor penalty, excuse me. So under the Clean Air Act, 1991, the penalty for failure to address the issues that come under the enforcement order, the order. I can't think of the name of the order, quite frankly, right now. But again, I'd invite you to look at the Clean Air Act. The penalty is $50,000 per day versus $2,500 period.
So it's the Home Affairs Minister who
That's
has
correct.
to decide
on
that then.
The Clean Air Act comes under, yes, the Home Affairs Ministry.
Yeah, would you be minded to advise him to do that?
Would I be minded to advise him? These are discussions that have been ongoing for several weeks now, and the minister, as well as myself, have committed to the residents of Pembroke our desire as a government to address these matters as expeditiously as possible.
Do you know when we might get a decision on that, though? Because this has been going on for a very long time now.
As I understand it, as was released by the minister last week, that those are matters that are under his purview, and he is expediting the review of those matters as soon as possible, recognizing the overall importance to the residents in particular that are impacted.
Finally, Minister, do you think it's acceptable that ambulance waiting times across the island are now going to be longer, according to the BHP, because of the concentration of resources at the airport? Is that acceptable?
Those are matters that are being discussed on a regular basis with the Cabinet, because we recognize that there were certain provisions that were made as it relates to the number of ambulances that have to be required at the airport. If it's a particularly, for example, Category 9, when there's a bigger planes that are coming in from BA, there's a requirement for more fire service personnel to be there at that time to maintain our international standing so that we can continue with airport operations. However, we also recognize that the benefits associated with having island-wide ambulance services are critically important, and those are matters that are being discussed and weighed into so that we can address those expeditiously to ensure public safety, and that I can say is of paramount consideration and importance to the government of Bermuda.
I think everybody understands
any
the argument about the
any other
airport
questions,
needing
Mr.
to be
Conley,
fully staffed, but
on any other subject?
people are genuinely scared that because of that, other ambulance services have been effectively cut with longer call-out times. So wouldn't the obvious solution be to give extra funding to that ambulance service for the rest of the island? So
those are matters that I think could probably be best addressed by the minister responsible for national security. However, I can end where I began, which is that the government is committed to ensuring that we have island-wide ambulance service so that the safety and preservation and protection of all of our residents is first and paramount.
Thank you.
Thank you very much,
Thank you.
Minister, for your time and your presentation. Thank you, news media, for attending, and that concludes today's news conference.
Thank you.